Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you is how really to best utilize P53 and P16 immunohistochemistry in supporting or even establishing the diagnosis of uterine leiomyosarcoma. So this is a case of a 34-year-old female patient who presented with abnormal vaginal bleeding and was found to have a uterine tumor or mass that was inoculated or excised. And this is the low power magnification of the tumor, where you see a spindle cell, cellular tumor with areas with scattered pleomorphic nuclei and areas of necrosis. And on high power magnification, pleomorphism is apparent, is clear in more than one focus in the along the tumor. So wherever you go in the spindle cell areas, there is this pleomorphism. However, another component that was also present in the tumor is this component, which at the very low power magnification and the first impression would be something like lymphangiectatic spaces or hemangioma-like spaces with epithelioid cells that are proliferating, forming those pseudo-angiomatous spaces. And the tumor here is composed mostly of epithelioid cells. And again, another area in the second component where we have the tumor composed of epithelioid cells, again with a prominent pleomorphism, forming here what looks like a nesting growth pattern and then sheeting really of the tumor cells with several mitotic figures. 1, 2, there was a third mitotic figure here, and so on. Really very highly high mitotic activity, highly proliferative in a tumor with both components, spindle cell component and epithelioid component, as well as atypical mitotic figures. So we have a tumor with two components, spindle cell component, epithelioid component in the uterine wall, in the myometrium, along with pleomorphism and prominent mitotic activities. In addition, areas of necrosis, coagulative type of necrosis are identified with this very characteristic peritheliomatous growth pattern, in which the viable tumor cells are only seen around, close by to blood vessels, otherwise away from those blood vessels. This is necrosis. So we have all the features that would support the interpretation perhaps of a leiomyosarcoma if we can support this by immunohistochemistry. And this is Disman immunohistochemistry, positive, strong positivity in the spindle cell component, not much so in the epithelioid component. And remember, quite often actually, Disman can be focally positive or even negative in leiomyosarcoma. So we have to keep this in mind, and this does not exclude the diagnosis of a uterine leiomyosarcoma. What is really important is a smooth muscle actin, which is diffusely positive both in the spindle cell component as well as beautifully positive in the epithelioid component, and H-Cal-Desman again positive in the spindle cell component and focally positive in the epithelioid component. But what really is helpful to support the diagnosis is the P53 immunohistochemistry. And in this example, in particular, P53 expression was abnormal, as there is total loss or null staining pattern of the tumor cell nuclei, both in the spindle cell component, in the presence of internal positive control, which can be either the blood vessels or the lymphocytes or inflammatory cells that are present. So in both the spindle cell component as well as the epithelioid component, P53 shows abnormal expression pattern, which in this case is the null staining pattern. And another focus, again, in the epithelioid cell component, the endothelium serves as our internal positive control. in order to make sure that our stain is working properly. But then the tumor cells, now the pleomorphism is so clear here, as well as the total loss of the nuclear staining would be consistent with null staining pattern equivalent to abnormal expression of P53. And then P16, again, positive in both the spindle cell component and more so in the epithelioid component. And here another focus in the epithelioid component, where we have both the cytoplasmic and the nuclear staining. Now, really, this abnormal expression of both the P53 immunohistochemistry and the P16 immunohistochemistry are a strong supporter to the diagnosis of uterine leiomyosarcoma. So put together the morphology, the presence of the pleomorphism, the very high mitotic activity, the coagulative type of necrosis, the immunohistochemistry, in addition to the P53 abnormal expression. In this example, it was the null staining pattern, as well as the P16 diffuse positivity, are all in support of uterine leiomyosarcoma. Remember that P53 and P16 can really be extremely helpful, especially in cases which are equivocal. We're not sure whether this is leiomyosarcoma or not. If they show the abnormal expression pattern, this would support the diagnosis of uterine leiomyosarcoma. Otherwise, their negative or the normal staining pattern, the wild type staining pattern, really does not exclude, and here I re-emphasize, does not exclude the diagnosis of uterine leiomyosarcoma. I hope you find this tip useful in your daily practice. Thank you.